Hi, I'm Paul Feinberg. I'm here today with Senior Associate Dean Alfred E. Osborne Jr. of UCLA Anderson School. He's also Faculty Director of the Harold and Pauline Price Center for Entrepreneurial Studies. Our topic today is the Johnson & Johnson Healthcare Institute, which is run out of the Price Center. Al, can you tell us a little bit about the project?
Good afternoon, Paul. I'm delighted to do so. The project really is a major initiative that we've undertaken to demonstrate how management programs and management training tools can actually help create positive results and outcomes, in this case, for families, poor families, parents and children of poor families who may not have access to proper literacy tools to fully understand and take care of the healthcare needs of their children. Because of the success the Johnson & Johnson program has had through Head Start, Johnson & Johnson felt that this was a wonderful vehicle for us to be able to do some significant things with the population that we were already training. The Johnson & Johnson Fellows Program has trained over 1,000 Head Start directors, and so if we could help the Head Start directors and their families do a better job, that's how the Institute was created. We've reached over almost 10,000 families, empowered these families to be able to make choices which has major implications for productivity in the workforce, school attendance, by just simply being able to take advantage and be proactive about the healthcare needs of their children.
Tell us a little bit about how the program worked and about the survey and study that the project has undertaken.
The program is designed to train the trainers, healthcare coordinators and Head Start agencies, if you will, on how to work with parents at a low literacy level. And in working with these parents, the project has developed a number of tools, including a book that was written by a nurse, a woman named Gloria Meyer, in association with another person, called What to Do When Your Child Gets Sick. The book was written at a literacy level for 3rd grade, which was found to be a useful tool to convey the learnings of what to do when your child gets sick. And we're talking about basic childhood diseases. Can you read a temperature? What to do with pink eye? What to understand with the earache, for example. Poor families often, when confronted with that, choices and these afflictions on their children, rush to the emergency room, maybe call the doctor. And the idea was, if we could somehow let them know that they knew what to do by being able to go to a reference book, like What to Do When Your Child Gets Sick, that would further empower them, but more importantly, alleviate the crush in emergency rooms and unnecessary trips to doctors.
And the study that the project has undertaken?
The Healthcare Institute is really the brainchild of Professor Ariella Herman. Dr. Herman, who is a researcher here at the Anderson School, working very closely for many years with the Head Start program, was asked to do a survey. Do a survey on what was really affecting parents and their inability to get to meetings and do things. And they were just busy, and a lot of the stress that they felt could be relieved, particularly when it came to worrying about the health needs of their children. So Dr. Herman's study found that if there was a way in which we could help parents reduce the time and reduce their worry in dealing with health care needs, they may be able to be more comfortable in their lives and find time for other things. Based on the needs then of this parent population, surveys were conducted of those participating in the Train the Trainers program in terms of their knowledge before training and then their knowledge after training. The results were astounding. One was, we were surprised at the number of visits, for example, to emergency rooms, the number of clinic calls that weren't made, all in the right direction of reducing the reliance on the healthcare system to answer basic healthcare needs for their children. The numbers, for example, ER visits to hospital dropped by 58%. Calls to clinics and doctors dropped by 42%. This translates into a major savings of $554 per family, or about $1 million or more like $5 million annually if the direct costs associated with those visits are put into account. And if you view the training as, say, costing about $60 per family, with a benefit of over $500 per family, is very, very cost effective. From an economic point of view, it makes sense to make families more literate about their health care needs on a prevention side rather than having to deal with the diseases and the afflictions that occur on a curative side further downstream.
Can you tell us a little bit more about the parent training aspect of the program?
I'll be delighted to talk a little bit more about the Train the Trainers model that is central to the development of trainers for this program. It is conducted over 2 days. Participants in this case are healthcare coordinators in Head Start agencies or others who would then go train parents. And this is the model that we've found to be more effective. We actually teach them broadly management principles, such like strategy, for example, or a little bit of how to manage projects. There are a number of teamwork building exercises worrying about parent mock training, where groups of coordinators work with parents and to simulate the actual training. We are taught a bit about parent and staff motivation to get the results done, and a little bit about marketing and communication. And what's interesting, each group from an agency that's trained commits to what we call a health improvement project, a HIP, if you will. And the health improvement project allows them to spell out what they're actually going to do in this whole literacy area. That's how we train the trainers. When we actually train the parents now, having been trained, that involves 2 or 3 hours of length with individual parents. The parents receive basic health care, medical information, and they learn how to use the book that I've referred to earlier on effectively. Some incentives are provided parents during the training, and they participate in the pre and post assessment surveys, which involves both qualitative and quantitative data, so that we will know something about what is happening. They agree to be part of a pre and post tracking, 3 months prior to training, 6 months after training, that allows us to measure things like calls to doctors, absenteeism from work and school, illnesses, and so on, and where they go for treatment that may be necessary. An interesting feature about the training, whether it's for parents or for trainers, is that it's done in many languages. It's not just English. It's done in Spanish, English, or Hmong, or Vietnamese, or Somalian, depending on the venue in which we find the Head Start parents. This has been a remarkable initiative made possible by the generous support of Johnson & Johnson family of companies through their corporate contributions, building upon the great success and rapport and really credibility we developed with Head Start agencies as a result of our Fellows Program.
What are some of the implications of the program, particularly for families without insurance?
The implications are clear. With 28 million children enrolled in Medicaid, and with over another 8 million or so uninsured in the United States, we can't ill afford not to pay attention to what the Healthcare Institute study and the work of Dr. Herman can indicate. This is a model, if you will, of the benefits that reach far beyond just this Head Start population if the society is willing to pay more attention to health literacy, be more interested in prevention rather than cure, and educate, therefore, patient populations about the advantages of knowledge, if you will, for children and families. I think if we do that, it will provide great benefits for our communities and reduce the burden on an already overburdened healthcare system.
What are some of the long-term goals for the Healthcare Institute?
The Healthcare Institute, under Dr. Herman's direction, has embarked upon a very, very ambitious series of projects. Their 10-year goal is to reach over 400,000 Head Start families. The Head Start program in this country reaches over 1 million children every day. And if you can reach this many families in this time period, you'd have made a significant dent in bringing health literacy to one of the most underserved populations. A key goal also in reaching out to Head Start families and impacting these almost 1 million children is the empowerment and control that it gives to parents who now think they can actually do something positive. And at low ends of the economic scale, empowerment and a positive attitude and being able to take care of your own needs is a major step forward. Other work will demonstrate the ability of, for example, these kinds of programs and this model to improve productivity, reduce absenteeism in school as you get children ready for school, for example, because they're not as sick as they could be, or parents' ability to spend time more on the job, or get educated for jobs because they're not spending time waiting in emergency rooms. The implications are, I think, very significant just to have literacy among all populations.
Can you tell us some of the areas of the country where the project has been involved? You know, who have we been helping over the years?
Over the last several years and going forward in the next several before us, the Healthcare Institute has touched almost every state in this country. As you know, Head Start is a national program, but Dr. Herman has chosen to focus in 3 states so far. She's done some work in New Mexico. The project has been long, and it'll go on for another year or 2, where they'll be touching some 5,000 families. This particular program is sponsored by the Pfizer organization. In the state of Washington, they're in the process of finally having a governmental sponsor. The program will start this year, and they plan to reach some 6,800 families in Head Start and early Head Start programs in the state of Washington. This has the endorsement of the governor of the state of Washington, who is very enthusiastic about this initiative. The state of Kansas trained some 5,000 families with dollars that were raised from a collaborative office between the Head Start agencies and a number of foundations in Kansas and Kansas City that help support the project. These early results are very encouraging, and any number of states and municipalities that be interested in being part of this effort to go beyond more than just understanding common childhood illnesses, but thinking about where the program is going with initiatives in nutrition, obesity, oral health, and so on. Now, if you are listening to this or learning about the Healthcare Institute and would like to support the program, there are a number of ways in which you can do that. We believe that this project is sufficiently important that you ought to let people in your state know about it. So reach out to legislators and others if you believe that prevention and literacy in health matters. If you want to learn more about the project, we invite you to visit the website, and we also invite you to use some of the prompts that are there that can help you communicate this message to others, like legislators and or interested foundations as you go forward.